Hi everyone, today your shrinking Bansko wants to talk to you about a very important and profound physical and hormonal transition that occurs in all women and that affects us all. Transition that both women and men, young and older, often know little about. As a result of the rise in workforce participation outside the home among women, an increasing number of women are experiencing the menopausal transition while in paid employment. Worldwide, more than 850 million women are currently aged 40 to 60 years old, and a whopping 51 million of you women will transition through perimenopause and menopause at an average age of 51 years. Although anything between 40 years and 58 is a valid transition age. Both puberty and perimenopause are developmental transitions that occur in the context of a fully functioning brain and body. In other words, both puberty and perimenopause are natural and normal developmental processes. Now, puberty occurs during adolescence and results in the conversion of a system that is incapable of reproduction to one with reproductive capacity in both female and male individuals. Perimenopause, on the other hand, is the period preceding the menopause and occurs in women only. But like for puberty in men and women, it is accompanied by shifts in both hormone concentrations and psychological states. All women who reach the age of 60 years with their reproductive organs intact, regardless of ethnicity, geographic location, or culture, will transition through perimenopause to menopause with a duration of 1 to 5 years from start to completion. Menopause is the final stage of perimenopause and is complete after 12 consecutive months of no periods. Important to remember here is that this final stage is associated with a decrease in secretion of estrogen and progesterone, hormones involved in the regulation of vaginal, skin, and bone health. I'm going to tell you more about this, so stick around. Now, despite the fact that almost every woman will go through the menopause, there is a negative narrative of the menopause itself. Some studies have shown that women with more negative attitudes towards the menopause in general report more symptoms during the perimenopause. The majority of occupational physicians recognize this taboo culture as well. And many doctors are unable to recognize menopause symptoms, which can lead to major effects in well-being. This possibility is reinforced by a survey of healthcare professionals in the UK that found that only half had received any menopause training and only 66% felt confident in managing the menopause. This publication found that many women felt distressed, confused, and even angry at their GP's lack of knowledge of the menopause and its treatment. Hickey and colleagues argue that social and cultural attitudes contribute to the varied experience of menopause and that medicalization fuels negative perceptions. When asked in some studies when they had first started thinking about the menopause, female participants' most common age range for answers was between 40 and 49. This suggests that many women only begin to think about the menopause when they near the age of experiencing it. Many women stated that they had only first started thinking about the menopause when symptoms began, or in cases of induced or early menopause. This indicates a lack of preparedness for the menopause, which is likely to make the process more overwhelming and psychologically taxing. Since many women do not know what symptoms are caused by the menopause, this lack of knowledge leads to delays in diagnosing the perimenopause and delays in advice and treatments. Health education interventions have been shown to improve women's attitude and experiences of the menopause. A study from Han and others in 2023 found that women's attitudes towards menopause were diverse and multifaceted, ranging from positive to negative. Some women viewed menopause as natural and empowering life stage, while others perceived it as a time of loss and decline. These attitudes were found to be influenced by various factors, including social-cultural context, personal experiences, and perceptions of aging. Now, to rectify a little this situation, Let's look at some of the clear physical telltales of perimenopause and menopause before we look at some of the psychological dimensions of this stage of life. Well-known menopausal symptoms include hot flashes, night sweats, and vaginal dryness. Let me explain them one at a time. Hot flashes are a very common symptom experienced by many women during the perimenopause and menopause stage. The prevalence of hot flashes among women who have completed the menopause can reach as high as 79%. Most women report hot flashes for up to several years before the onset of the menopause that range from less than 1 to more than 15 episodes a day. Hot flashes are characterized by a sudden intense feeling of heat, often accompanied by sweating and redness of the skin. During a hot flash, a woman may suddenly feel as though her body temperature has spiked dramatically. These flashes are also often accompanied by sweating, sometimes profusely, a way for the body to cool down after the sudden surge in temperature. Some women may also experience a rapid heartbeat or palpitations during a hot flash. And because this can happen during a night's sleep, insomnia is a prevalent symptom of the perimenopausal transition. Hot flashes can be uncomfortable and disruptive to daily life. Finally, vaginal dryness. During menopause, a woman's body undergoes a significant decrease in the production of the hormone estrogen. Estrogen plays a crucial role in maintaining the health of the vaginal tissues and keeping them moist and elastic. The decline in estrogen levels can lead to various vaginal changes, including dryness. Vaginal dryness can cause a range of uncomfortable symptoms, including itching, burning, and a sensation of vaginal tightness. In addition to dryness, menopause-related estrogen loss can lead to the thinning of the vaginal lining. This makes the vaginal tissues more delicate and prone to irritation and injury. Vaginal dryness can also be associated with urinary symptoms, such as an increased frequency of urination, urinary urgency, and a higher risk of urinary tract infections. These symptoms may occur because the urethra, the tube that carries the urine from the bladder, is located close to the vaginal opening, and changes in the vaginal tissues can affect the urinary tract. Vaginal dryness, therefore, can significantly impact a woman's sexual health and quality of life. It can lead to pain or discomfort during intercourse, decreased sexual desire, and an overall sexual dissatisfaction. Other symptoms of perimenopause or menopause may include muscle or joint pain, subjective or objective memory deficits, and for those prone to headaches and migraines, these may worsen during the perimenopause. Now, after menopause, the risk of coronary heart disease doubles for women. A strong correlation exists between the magnitude of weight gained during the perimenopause and a worsening of cardiovascular risk factors after the menopause. So close attention to weight gains is therefore a major component of good preventive health care for all women. Now let's look at the psychological dimensions of perimenopause or menopause. Relief from the burden of periods. In this study, women generally felt a great sense of relief that they would no longer have to deal with the inconvenience and physical discomfort caused by periods. This was especially true for women with uncommonly heavy or painful periods, of course. In the words of a fellow woman, "I've suffered from painful and heavy periods all my life. Part of me looks forward to not having to deal with them anymore. I won't miss the pain and the inconvenience." Sadness of aging. Many women in this study saw no longer having periods as a marker of aging and felt sadness at the prospect of losing their youth. "It means I'm old," said one woman, "washed up, invisible. It's closing the door on any semblance of youth, and I don't want that. Feels like the beginning of the end." One study discovered that 12% of perimenopausal women had moderate or severe depression, and the depression severity related to educational level, loss of fertility. A large number of women in this study expressed deep sadness and grief at the prospect of losing their fertility. This feeling of loss was particularly profound in childless women, who felt that no longer having periods represented the end of their chances to conceive. "I'm sad," said one woman, that I never had children, and soon the menopause will signal that I will now never have the chance. An extra note on this dimension though, as most women in this study fail to acknowledge that fertility begins to decline many years before the menopause, perhaps suggesting a lack of understanding that female fertility declines rapidly from the mid-30s. This take would be consistent with numerous other studies which highlight the lack of awareness of age-related fertility decline in women. Now, loss of identity is the fourth factor that was mentioned by women. Some women associated no longer having periods with a sense of loss of identity. I feel like losing my identity, femininity, my connection to my body. Utterly lost, grieving, confused, totally helpless, struggling every day with mental health. Overall, these symptoms negatively impact various aspects of a woman's quality of life. For instance, increased risk of depression in perimenopausal women is supported by evidence from several longitudinal studies that have documented ratios ranging from 2 to 3 times increased risk compared with women before the perimenopause period. Now, one study reports on strategies used by women around the world to manage symptoms. So let's have a look at this list. Turkish women who participated in a study conducted by Alll in 2016 used cool shower, cold compresses, removing clothing, and drinking water to relieve hot flashes. Some women from Ghana incorporated pain-relieving medication. Women across other studies from Ghana, Turkey, Australia, and Laos identified incorporating exercise to assist in relieving and coping with symptoms to be very good. This is encouraging, as exercise is not only associated with a greater health in menopausal women and decreased menopause symptoms, but also general health benefits such as reduced cancer risk, improved cardiovascular health, and improved mental health. Nutrition was also reported as a strategy that women from Ghana, Turkey, Australia, and Laos used to help manage symptoms, with strategies ranging from eating a good diet and incorporating soybean into their diets. Participants in some studies from countries including Ghana, Turkey, United Kingdom, and Sri Lanka reported drinking boiled onion water or herbal teas such as milfoil, chamomile, and ginger, adding wild asparagus, curry leaves, and garlic in their diet to relieve symptoms. I haven't tried it on myself, but I believe the research and I trust the wisdom of these women. Now, stress reduction and diversion techniques such as praying, reading, engaging with friends and family to help manage symptoms were also identified by women from various countries, including Turkey, UK, Sri Lanka, Laos, and Australia. Aboriginal Australian women further elaborated upon these stress reductions and diversion techniques, using music and having a sense of humor. Duffy 2013 specifically identified complementary therapies including massage therapy, acupuncture, reflexology, counseling, and psychological support as strategies used by women from the UK to alleviate symptoms as well. Finally, some women use hormone replacement therapy. Now, perimenopausal women in general were significantly more likely than postmenopausal women to manage symptoms with exercise or nutrition changes, such as reduced alcohol or caffeine intake, and significantly less likely to use hormone replacement therapy. This suggests that younger perimenopausal women may have a greater preference for lifestyle changes and other non-hormonal methods to treat menopausal symptoms. Hopefully, our collective efforts to raise awareness and sensitivity towards these and other transitions in our lives will continue. For now, take charge of your own education and awareness and share with male and female friends alike with dignity and joy this information. This is your shrinking Bansko. Look after your heart.